What if I told you that a seemingly harmless tiny white crystal in your kitchen could be quietly sabotaging your health? Spoiler alert, it's not sugar. It's something you use every single day. Excessive table salt consumption can wreak havoc on your body, both now and in the long run. Today, we're peeling back the layers on table salt, the everyday seasoning that enhances your fries but hides some startling truths. Stay tuned as we uncover the shocking realities of this common kitchen staple. First, what is table salt? It mostly comes from two sources: underground mines or evaporated seawater. It's then cleaned, processed, and mixed with anti-clumping chemicals. The surprising part? Our bodies only need a small amount of sodium to stay healthy, yet many of us consume far too much. Once processed, table salt is primarily sodium chloride, NaCl. Depending on how it's made, it may also contain trace minerals and additives like iodine in iodized salt to prevent deficiencies. Some anti-caking agents, such as sodium ferrocyanide or calcium silicate, are deemed safe in small amounts, but their long-term effects on health remain uncertain. We'll break this video into two parts: short-term effects and long-term effects. Then, we'll dive into other health issues linked to table salt. Finally, we'll reveal some healthier salt alternatives. Let's get started. Short-term effects. Number 1. Fluid retention. High salt intake causes your body to retain water as it tries to balance sodium levels. When you consume too much salt, sodium enters your bloodstream and disrupts your body's fluid balance. Sodium helps regulate water inside and outside your cells, but when levels are too high, your body holds on to extra water to compensate. This leads to fluid buildup, often resulting in visible swelling, known as edema. Swelling is most noticeable in the hands, feet, ankles, and face, as gravity pulls excess fluid to these areas. It can also cause bloating, making your stomach feel tight or distended. Fortunately, these effects are temporary and can be reduced by drinking water and cutting back on salt. Number 2. Increased thirst. Your brain's hypothalamus regulates thirst by monitoring fluid and electrolyte balance, including sodium levels. When sodium levels get too high, the hypothalamus signals thirst, prompting you to drink more water. This helps dilute the sodium in your bloodstream and restore proper hydration. However, drinking more fluids after consuming excess salt can lead to temporary water retention. While this helps balance sodium levels, it also increases overall fluid volume, causing bloating or puffiness, especially in the face, hands, and feet. Fortunately, once sodium levels normalize, these effects usually subside. Number 3. Temporary rise in blood pressure. Consuming too much salt can cause a temporary spike in blood pressure, mainly due to increased blood volume from fluid retention. When sodium levels rise, your body holds onto extra water to dilute the excess, which leads to more blood circulating through your vessels. This increased blood volume puts extra pressure on your artery walls, causing a temporary spike in blood pressure. While this effect may not last for everyone, it can be especially concerning for those with pre-existing hypertension or other heart-related issues. For these individuals, even short-term blood pressure increases can worsen their condition and raise the risk of complications like heart attacks or strokes. The kidneys help filter excess sodium, but if they become overwhelmed, it can contribute to sustained high blood pressure over time. Number 4. Hypernatremia. Hypernatremia is a condition marked by high sodium levels in the blood, typically defined as a serum sodium concentration above 145 millimoles per liter. This can occur from excessive salt intake, especially when combined with inadequate water intake or significant fluid loss. When sodium levels become too high, the body struggles to maintain fluid balance, leading to various symptoms and complications. One of the main signs of hypernatremia is intense thirst, as the body urges you to drink more water to dilute the excess sodium. As sodium concentration rises, it can also impact the central nervous system, CNS, causing symptoms like confusion, irritability, and muscle twitching. In severe cases, hypernatremia can lead to even more serious complications, such as seizures or coma, if not treated promptly. High sodium levels can cause brain cells to lose water and shrink, disrupting normal brain function. Maintaining balanced sodium levels is crucial, especially for neurological health. Excess sodium can interfere with communication between nerve cells and disrupt overall brain activity. Long-term effects. Let's start with the big one: high blood pressure, also known as the silent killer. When you consume too much salt, your body retains extra water to dilute it. Think of your blood vessels as a garden hose. Too much pressure, and the hose begins to bulge and weaken. Over time, this puts strain on your heart and arteries, increasing the risk of heart attacks or strokes. Long-term high salt consumption is strongly linked to chronic hypertension, where blood pressure stays consistently high. When people consume too much salt, especially sodium, it causes an increase in blood volume due to fluid retention. This added blood volume forces the heart to work harder to pump blood through the arteries, raising blood pressure levels. Over time, this extra strain can lead to serious health problems. Chronic hypertension is a major risk factor for cardiovascular diseases such as heart disease and stroke, as the rising blood pressure puts more stress on the heart and blood vessels. Number 2, cardiovascular disease. Chronic high sodium intake is linked to several cardiovascular diseases, including left ventricular hypertrophy, enlargement of the heart muscle, a major risk factor for heart disease. As mentioned earlier, the increased blood volume forces the heart to pump more forcefully to meet the demand. However, over time, this strain can cause structural changes in the heart muscle, such as left ventricular hypertrophy. Additionally, sustained high blood pressure can damage the arteries, reducing their elasticity and making them more prone to plaque buildup. This narrows the arteries, which further raises blood pressure. This creates a vicious cycle where hypertension leads to worsening cardiovascular issues, including heart failure, a condition in which the heart can no longer pump enough blood to meet the body's needs. Studies show that reducing sodium-rich salt intake can lower blood pressure and improve overall cardiovascular health. Number 3, kidney damage. Excessive sodium can place strain on kidney function over time. As the kidneys work harder to filter out the excess sodium, they become less efficient at removing waste and fluid from the body. This can cause fluid buildup in tissues, leading to conditions like edema, swelling, and higher blood pressure. High blood pressure can also harm the kidneys, creating a vicious cycle where both conditions worsen each other. Additionally, long-term high salt intake has been linked to increased protein levels in urine, a condition known as proteinuria. Proteinuria is a major risk factor for declining kidney function and may signal kidney damage. For individuals with chronic kidney disease, CKD, excessive sodium can speed up the progression of the condition, leading to more severe health problems. This is particularly concerning for those with pre-existing conditions like diabetes or hypertension. Number 4, osteoporosis. High salt diets can significantly lead to calcium loss through urine, weakening bones and raising the risk of osteoporosis, a condition marked by reduced bone density and an increased likelihood of fractures. When sodium intake is high, the body compensates by excreting more calcium in the urine, a process called calciuria. This calcium loss is harmful since calcium is vital for keeping bones strong and healthy. Research shows that with every increase in salt intake, there's a corresponding rise in urinary calcium excretion. For example, studies have found that a 100 millimole increase in salt intake can lead to an additional 1.4 millimoles of calcium lost in urine. Over time, this ongoing loss can cause significant bone demineralization, resulting in about 1% extra bone mass loss each year. This gradual deterioration can lead to osteoporosis, making bones more fragile and prone to fractures. This is especially concerning for postmenopausal women and older adults who are already at a higher risk for osteoporosis due to hormonal changes that affect bone density. Number 5, stomach cancer. Research has shown a link between high salt intake and an increased risk of stomach cancer. This may be due to the damage it causes to the stomach lining or the promotion of Helicobacter pylori bacteria growth, which is associated with gastric cancer. Other health concerns. Gout and kidney stones are two conditions associated with high sodium intake and disrupted mineral balance in the body. Gout, an inflammatory arthritis, causes sudden and severe joint pain, often due to elevated uric acid levels that form crystals in the joints. High sodium intake can worsen this condition by increasing uric acid production. Excessive sodium intake also contributes to the formation of kidney stones, especially calcium-based stones, by increasing calcium excretion in urine. Both gout and kidney stones emphasize the importance of managing sodium intake to maintain a proper mineral balance and reduce the risk of painful flare-ups or stone formation. While sodium is crucial for various bodily functions, moderation is key. Health guidelines recommend limiting daily sodium intake to less than 2,300 milligrams to effectively mitigate these risks. Thank you so much for watching. We hope this deep dive into table salt has been both enlightening and eye-opening for you. If you're curious about alternative salts, be sure to check out our other video on Celtic and Himalayan salt, which you can find on the screen now. Don't forget to like, subscribe, and hit that notification bell for more valuable insights like this. See you in the next video.